Hello, kidney warriors. James here from Dadvice TV, your online kidney health coach. And this is Dadvice TV Live. And for those of you that are new, welcome. Great to have you here. We have an awesome, supportive community. So go ahead, introduce yourself in the comments and let us know a little bit about yourself. If you ever got a question, feel free to ask it. If I don't answer it, or our guest, tonight is Jen, you may be able to get some answers or at least some guidance for good questions to ask your doctor from our community. Now, for those of you that are new, let me quickly introduce myself. My name's James. I have kidney disease. Matter of fact, don't just have kidney disease. I was diagnosed with stage 5 kidney failure in November of 2018. Doctors told me I probably had to go on, they said I had to go on dialysis to live. I didn't go on dialysis and I didn't get a transplant. Instead, I got a little lucky. I worked on my diet. I worked on lifestyle changes. I worked very close with my doctors, get my blood pressure under control, started being active, exercising and walking and stuff like that. And I improved my overall health, which lifted up my labs and let me get rid of every single symptom of my kidney disease, or as I like to say, kick kidney disease to the curb. Now, my kidneys are not stopping me from doing anything. Now, that's a little bit about me. Let me get to our guest because we got another big topic for tonight. Back again. It's Tuesday. Here she is, Jen Hernandez from Plant Powered Kidneys. Hey, Jen.
Hey, James. Hey, everybody. So happy to be back on this lovely Tuesday evening. And I just wanted to say hi to our new viewers, anyone that's jumping on brand new. Of course, you followers that have been watching us for weeks now, hello to you too. But for the new people that are jumping on, in case you have never met me, you don't know who I am or this whole plant-powered kidneys idea, my name is Jen and I'm a renal dietitian. I'm a registered dietitian in the United States, also board certified in renal nutrition. And I have a bunch of different support and ideas and topics for you guys all. As James has so kindly put it up here on the side of the video, you can see the different resources that I have. So my website is plantpoweredkidneys.com. We have a private Facebook group that is technically open to the public, but you need to request to join to get access, and just search Plant Powered Kidneys on Facebook and you'll find us there. It is a wonderful, James and I were just talking about the group right before we went on live about how awesome the group is and motivating and inspiring and uplifting. So if you are looking for that kind of support system from a bunch of people that are in a huge range of kidney issues, that's definitely a Facebook group you should be checking out. The other thing that I have been providing newsletters to the people that are getting emails from me. We did it a couple times a month, but we're going to start with weekly newsletters. So if you want to be kind of in the know about everything, we share recipes, we share articles and studies, we do little updates about what's going on. We have a ton of things that are available in the newsletter, so you can sign up for that on the website. And then, of course, as a dietitian, I work with people privately, one-on-one in the United States. And then I also work with people in our online course, the Plant Powered Kidneys course, which right now we are in week 2 of the course. So enrollment is not open at the moment, but you can go to the website and go on the wait list for the next time we announce the live enrollment. So if you're interested, I would say check that out. I know there's quite a few of you that are in the course, and if you have any kinds of words of wisdom to share with other people, you guys know that I value your opinion and your words so much more, and you speak volumes louder than I do, because I'm totally biased as a dietitian of saying that food is great.
Well, for those of you guys that don't know, my history, those of you that are new, you're probably wondering, how, James, did you really get your kidneys and your overall health better? It came down to the single most important thing I did was working with a renal dietitian so that I was no longer afraid of food. I learned that I didn't have to run away if I saw an orange or some tomatoes or something like that. No. a renal dietitian was by far the biggest help. Now, a question in tonight's topic is, hey, how can I use my insurance, and this can sometimes be challenging, to get a renal dietitian or a registered dietitian or a nutritionist, covered by my insurance? So that is what we're going to answer tonight. Does insurance cover nutritionist? And we're going to kind of go through some of the steps to help you hopefully get your insurance to cover getting you to what I think is the most important and most helpful tool for fighting kidney disease, working with a renal dietitian. All right. Absolutely. So we're going to go back to, we're going to start at the very beginning. Jen, can you tell us about, here in the United States, and that's one other thing. The insurance part applies here to the United States because that's where Jen and I are. In some other countries, it's going to be completely different. So, but I don't want those of you that are watching from other countries to jump ship. You might learn something you can share in a group or something for other kidney patients who are like, oh, I don't know, I can't afford a renal dietitian, or I don't know what to do. You're going to learn some stuff that you can share with them and look like a hero, helping them get one of the best resources. So Jen, what are the different...
Honestly,
yep.
I was just going to say really quick for our international viewers, honestly, we would probably appreciate your comments during the conversation if we're talking about something that you can relate to your country, your area, and say, oh, it's just a little bit different this way. That's going to provide more help for other people that are around the world and kind of wondering how to connect it. So if you hear something that you're like, that sounds familiar, or I've done that, or our insurance company, blah, blah, like whatever you can put in and chime in with, we welcome that kind of feedback, and I know others do too. So please chime in and share your comments if you have something that is relevant for your country and this topic.
Yep, great. So what are the types of insurance, or I guess they're known as payers in the industry here in the United States?
So there are several types of groups, basically types of payers. So we have private payers, and these are companies that are run privately. They're not managed by the government or any kind of federal regulation or state regulation. They're their own company. So some of the most common ones that we know about that you might be familiar with are United Healthcare, Aetna, Cigna, to name a few. If you have your health insurance card handy with you tonight, I would highly recommend that you go grab it, because this is going to be a great time for you to kind of read along and maybe help determine some of those things. So what you want to do is look at the name across the top of your card, and it will give you a clue as to who your insurance payer is. So again, private pay is going to be that first bucket of those big companies. Most likely you're going to see them like commercials or things like that, because they are a business and they're running their company. So we have them. Then we have Medicare. Medicare is the federally run insurance program. So it's for people that qualify at or over the age of 65, or with certain conditions like kidney failure. So people with kidney failure on dialysis qualify for Medicare. And if you are on dialysis, you've probably had this conversation with your social worker about getting on Medicare, because it's one of the most common insurances available, and it does help in covering dialysis costs, which is very expensive, like over $90,000 a year for just to get the dialysis treatment itself, not let alone everything else. So Medicare covers 80% of dialysis treatments. And then usually you'll have a secondary insurance. You'll have another type of insurance that comes in to cover the rest of what you would owe. So in some cases, people may be automatically enrolled into Medicare, but in most cases you have to apply. So again, for people with kidney issues on dialysis, this is not any stage of kidney disease I'm talking about right now. I'm talking about dialysis. So if you're on dialysis, you qualify for Medicare, and you can talk with your social worker in your clinic about getting that application. So there's also this, so Medicare, and I could do like a whole thing talking about Medicare itself. I've had to learn a lot about insurance in private practice and then in dialysis as well. So there's Part A, Part B. kind of a part C we'll get into, and then part D. So part A is the hospital stuff. Part B is the second, or think of it as like auxiliary supplement. I, as a dietitian, fall under part D or part B services. Part C is more like Medicare Advantage plans, and then part D is the drug prescription plan. So D, drug, makes sense. So that's kind of a big picture of what Medicare is. And then we have Medicare Advantage plans. Now, Medicare Advantage plans are actually plans from the private payers, so from those big companies, but it's actually a Medicare plan. So they follow the Medicare guidelines of what's covered and not covered. And each of these companies will have different determinations on what they consider should be covered or not covered, depending on the company, depending on who's funding them, whether it's the government or the private payers. And then finally, I just wanted to pause in case you wanted to jump in, James.
Oh, no. This is good information, especially for those that, I've heard from so many people that, kidney disease is a silent killer. So they may not learn about it until they're like me at stage 5. And this is information that is so, so critical. And I remember me trying to figure it out in the ICU, like, okay, wait, how do I pay for dialysis? And how do I pay for a transplant? And I'm sitting here looking up all this. It was so confusing. So yeah. I don't want to interrupt you with this good information.
Well, I've just got one more type of plan, which is TRICARE. And TRICARE, if any of you are veterans or have served in the military, TRICARE is the military's insurance plan. So that is for active duty and anyone who's been honorably discharged and their families, retirees as well. And the TRICARE plan is very similar to other healthcare payers, similar to Medicare, similar to private payers. It's just the option for military and those who are involved with the military.
Yep. And now what about Medicaid? I know that's another one that, especially here Medicaid. In Ohio, we see it a lot.
Yes. So Medicaid is a state-run plan. So everybody from state to state will have their own Medicaid plan available to them. Medicaid is another option that you may qualify for when you're on dialysis. Very, very often in dialysis, we had the term Medi-Medi. So if someone had Medicare and Medicaid coverage, they were Medi-Medi. And that was just our jargon, I guess. But Medicare is very, very often, or Medicaid, I'm sorry, is very, very often that second insurance that helps pick up where Medicare doesn't cover. So Medicare is, I feel like I'm blurring my words together. Medicare is the federal government insurance program. Medicaid is the state-run insurance program. CHIP, if any of you have children or have ever qualified, the CHIP program is the Children's Health Insurance Program. And that is basically an insurance program for people qualifying at low income for their little ones, anyone under the age of 18. So that is part of the Medicaid, so falls under the state program. I believe that's it.
Yeah, very good. Now, so I actually have a the first one provided by my work, and two things that I'd love for you to touch on before we get into the next section, which I find very helpful for kidney patients and for things like what we're about to talk about, working with the dietitian. HSA and FSA. Can you briefly tell us what those are?
Well, first of all, they're like my favorite thing ever because for one, it saves you money on taxes. So HSA stands for Health Savings Account. This is something that oftentimes a private payer, a private company, United, again, Aetna, Cigna, those are the ones that keep coming up to me. Those plans may have a plan called a high deductible plan, meaning you pay more out of your own pocket to get your services. But to help offset that cost, they offer what's called a health savings account where you can put money aside before you get taxed. So it lowers your taxable income, and you're basically creating a savings account that is only intended to be used on your health. And when I say that, it's kind of a loose and fast rule, so to say. I definitely don't want to encourage any kind of abusing of this type of account, but you can buy like contact solution. I've done that. You can do courses. You can do work with a dietitian. Like anything that qualifies as something that is helping your health will qualify. You may need to provide extra paperwork or documentation. If you go to CVS and you get your contact solution that way, keep the receipt so you have that on hand just in case they ask for proof, because you might need to show that to actually get the credit or to use that money that way. So make sure you hold on to those things. The other one is the flexible savings account. And this one is similar, but you have to use, this is like a use it or lose it situation.
Yeah.
You have to use all of your funds by the end of the year in order, because they won't roll over into the next year. So health savings, they can accumulate. And some employers do provide matching or benefits with these programs. So if you have that opportunity, definitely ask your employer, talk to your HR department about if that's available, what the situation is, because it's free money. It's free money that's going towards your health, you know?
And I love my HSA. First of all, it's a credit card. And pretty much if I go to Walgreens, which is the store I use, anything I get out of the pharmacy department, the card gets swiped, boom, it's covered. So I'll use it like if I needed some Tylenol or something, I'll buy that there at the pharmacy. I use it for my deductibles when I'm either at the doctor or my copay on my my prescriptions and things like that, because I have it is a high deductible, or we call it at work painful insurance. It hurts to use it in the beginning, but after a while you've gotten enough pain that then it seems to kick in.
Right. And that's one of those things with these different plans, which I don't know. I know we don't need to go too much into that in depth tonight, but that is something to consider when you're looking at different healthcare plans, is thinking about, essentially it's like budgeting, thinking about where, because you're going to spend money. We all spend money on our health. There's no question about it. It's just a matter of when and where and how. That's what it comes down to. So make sure you're making an educated decision when it comes to picking out a plan and a provider and everything in there, because in the long run, you can't just up and change your plan all the time. There's certain windows of enrollment. So once you pick it, you've got it for a while.
Yep. So I mentioned a nutritionist earlier. What is the difference between a dietitian and a nutritionist?
It kind of burns me when I have to explain this. And I know I need to explain it because not everybody knows. Yep. So many people use them interchangeably. And I know, and I don't feel any ill will or anything. Okay. So a dietitian like myself has to go through and get at least a bachelor's degree. In 2024, they're requiring new dietitians to get a master's degree as well before they can sit for the exam. Yeah, so they're really upping the game. Then after getting your degree, you have to qualify and get accepted into a dietetic internship, which is highly competitive. And I wish I could find where the statistic was, but there was a statistic floating around not too long ago that said dietetic internships are statistically harder to get into than medical school, because there are so few dietetic internships and so many people that want to become dietitians. It is a very, very tough thing to get into. So you have to get into your internship, and then you do 1,200 hours, 1,200 hours of supervised unpaid work. So you're basically working for free for 6 months. And then you qualify to take the exam that is a national exam to become a registered dietitian. That's the base of how to become a registered dietitian. If you move forward, such as myself, becoming board certified in renal nutrition, that requires another several thousand hours of work, of practice work. Luckily, it can be paid work, so I'm not working for free, but
oh, good. Thank goodness.
But I do need to have another several hours or several thousand hours of work to verify and show that I know what I'm doing. And then I sit for another test. So it's a long process. It is years and years of work. Now, the other side of the coin, in a sense. Nutritionist. James, if you wanted to, right here, right now, you can call yourself a nutritionist. Can't do anything about it. Literally, there is no regulation on the term nutritionist. Anybody, they can print off a certificate if they wanted to go through the trouble. They could print off some kind of certificate online. They could take some kind of online course. I see them floating around all the time.
Oh, I've seen them too.
Yeah, it's astounding, honestly. But I mean, these people are marketing geniuses to get that out there. It's just the point when somebody gets sued because they thought that they could do something that was out of their scope of practice.
Mm-hmm.
So a nutritionist is a very broad term. Again, anybody can call themselves a nutritionist. There is a credential called Certified Nutrition Specialist, and that does require a degree in nutrition. And I think there's an exam involved. Obviously that's not the path I went down, but you'll see the CNS behind their name. So Certified Nutrition Specialist. And as far as insurance coverage, I believe plans will generally take them as a provider in most cases, but this is something that you'll want to talk to your insurance company about and ask if it needs to be, or sometimes they put it on their website too. I know for Medicare, they'll say a dietitian or medically qualified nutrition specialist. So I know a doctor can give nutrition advice and bill for it. But for this nutritionist realm, it's very, very muddy. Anybody who tells you they're a nutritionist, I would just kind of take a second and then think like, okay, so what does that mean to you? What is that?
Yeah.
What did you do to become a nutritionist? And, oh, well, I took this 2-day course online and here I am.
Or I just wrote it on my website.
Yeah.
Started calling myself it.
I typed it on there and now I'm a nutritionist.
I spelled it right too.
Yeah. Oh yeah.
So, in my opinion, I always say renal dietitian, and I just worked the word nutritionist in here because I've seen it online, and I actually started keeping an eye out over the last few days on Facebook, and I did some searches, and then I was getting ads for nutritionists, and I'm like, oh my goodness. Me, it's a renal dietitian all the way. First of all, I need a renal dietitian. Being diagnosed stage 5, even getting into stage 4 and at the bottom into stage 3, I want one who knows about kidney disease, not just other stuff. Though those of you out there who may be at stage 2 and you have diabetes, a regular dietitian is still going to be a ton of help for you.
Oh yeah, absolutely. Absolutely. And us dietitians, we are a small but mighty group, and we have our own networks and we work together. And when we have a patient that we really want to help, we'll reach out to our colleagues and we'll say, hey, I've got someone who has diabetes and kidney disease. I just want to make sure that we're on the right track. They don't share your information. They're just looking for other brainstorming ideas of how to help in your case. So we are very much a very helpful community, and we all want you to get taken care of. So finding a dietitian, and that's, if we could just summarize this episode in a nutshell, the bottom line is just to help you find a dietitian that you can work with, that in whatever aspect that is, through your insurance is awesome, because there are a lot of dietitians that take insurance.
Yep. So let's move on to that. How do I find out if my insurance will cover a dietitian? Okay.
So this is going to be, the way I'm going to explain this is almost like a step-by-step tutorial. So if you have a pen and paper handy, that's great. Again, if you have your insurance card out, that's great too. But I'm going to give you some bullet points basically of what you want to do, the specific things you want to take care of when you're talking with your insurance company. So I'm going to list it all out for you here, step by step of what to do. Okay, so the first step is to contact your health insurance provider, the company that is giving you health insurance. Most oftentimes you can find this number on the back of your health insurance card, and they'll have a customer service or a patient service, something like that. So you can reach out to them directly using that number. So make sure you call the number they provide for customer service. And once you get through all the keypads and answering, the little press 1 for this, press 2 for this, once you get to finding out who you can speak to, make sure you write down the name of the person you're speaking to. Once you get to a live person, it is very, very important. This is really backing up from the moment, like for the rest of the conversation you have with them, whatever notes you take. If anything gets contradicted or if they don't cover something, whatever the case is, you can go back, and I'll give you more information here, a little bit of what else, but you're going to have a name. I spoke to John, and John said that I need X, Y, and Z. You're going to have a person to put to it. So it's going to help them to look back in the records. So the other thing, and I'll just say it now since we're on the topic, at the end of the call, there is a reference number for your phone call. So they record all these calls, and usually you hear them say like, this call is recorded for customer service or satisfaction or training, whatever the case is. There is a reference number to your phone call. So make sure you get that reference number down as well. So you say, I spoke to John, reference number 2345678, exactly. Whatever it is, get it written down, repeat it, have them repeat it, triple check it, make sure you got it right, because this is the stamp of whatever was said. You'll have that on record. And I do know that sometimes things that weren't covered do end up getting covered simply because somebody had that proof and they said, I spoke to John and he said it was covered, and they looked up the reference number and they're like, oh, look at that. Yep, you're right. He said it is. So we'll cover it for you. So it's really, really important to get this information down. Okay.
Got it.
All right. Okay. Do you want to jump in on anything, James?
Oh, no, I'm good. Boom. We have so much to go over. I'll jump in. I'll jump in where I have something good to add that'll help it.
Perfect. Okay. All right. So the next thing is you want to find out if you have nutrition services covered. So all you need to ask, are nutritionists covered by my insurance? And the codes, there are certain, they're called common procedure codes or common procedure technology codes, CPT codes. These are the codes that you can use about nutrition coverage. So you can say, what about CPT 97802, 97802, or 97803? Okay, so 97802 or 03. Those are the codes that you can ask about, and that is essentially medical nutrition therapy. The 2 is your first session, the 3 are all of the additional sessions. So you can find out, and they'll tell you, you have this many units or this many sessions available under these codes. So that is, first of all, what you're going to find out if the service itself is provided. The next thing you need to find out is if you have ICD-10 codes that are required. So in some cases with some plans, you might have certain restrictions on what's covered. In my most specific example, Medicare only covers diabetes and kidney disease for nutrition services. So if somebody comes to me with high blood pressure, if they don't have kidney disease, if they don't have diabetes, I can't see them, not at least through their insurance. So it has to be certain codes. So the way you can find out what your ICD-10 codes are is to look up in your client portal, your patient portal, or if you can get some kind of doctor's note, like his actual or her actual written note from your appointment. They will include those notes, usually at the bottom, sometimes at the very top, or you can just call the doctor's office and say, hey, what are my ICD-10 codes? And they will list them out for you. And they're basically the codes that are associated with the illness, with the disease. And there's over 70,000 of them.
Yep.
And they're getting ready to create a whole new series in a couple of years, I think, coming up. They're going to totally revamp them and change them. So yay, insurance.
Yeah. Now these codes, this is definitely an area that I have learned a lot about and how to get them to work for me. And my primary care physician was the one who actually taught me about this. In the beginning, my insurance didn't cover a renal dietitian for exactly where I was, with my health. But they did cover seeing one for being overweight. And my doctor, he said, look, I know you don't like to talk about your weight, but I can code that you're overweight. You are. It's not lying. And you'll go and you can see a renal dietitian a certain number of times because of that issue. Also, I was pre-diabetic. Boom. There was another code that he got to use to get me more labs that I wanted and more visits to a renal dietitian. And that has just been, like magic. He works with me, plus every year I get a physical, and there's certain things that are allotted within it, and I can use some of that to see a renal dietitian. So we've worked together to find ways, playing within the rules, not breaking the rules, to get me to see a renal dietitian, getting it completely covered by my insurance, which is great.
Mm-hmm. Mm-hmm. Absolutely. Yeah. So whatever kind of codes, set the ego aside. Just like James said, you set the ego aside. You're like, hey, if this is going to help me, this is going to get me where I want to be, then yes, let's do that. The more information you have, the better. So make sure you get all that down from your doctor. You can call the office. You can pick up a copy of it. They can mail it to you, email it to you. You might find it in your portal under your list of diagnoses. It's usually like a letter and then number, dot, number, maybe. So here's an example. The code for preventive nutrition, as in we are trying to prevent things from happening, we are trying to get ahead of this, is Z71.3. I had to look at my notes just to be sure. I don't want to give you guys the wrong information. So Z71.3 is the preventive nutrition code. So that might be something that can be covered, and you can ask that representative you have on the phone, what about Z71.3? Is that something that I can use? And they'll tell you how many sessions that you can use with that code. So be sure to get that information from your doctor ahead of the call if you want, or if you're on the call with the representative, just say, hey, are there any limitations? Are there any certain codes? And they might give you like a category like kidney disease, or they might give you a few random numbers or something. Whichever person you're talking to first, doctor's office or representative, just get as much information as you can from them.
Yep. And Mike asked a great question. Does this help with other things, like if they have digestive issues? Yes. See your family doctor, your primary care physician, and if there is something that a dietitian can be helpful for you, some nutritional services can help you, they can code and refer you or get you over there to a dietitian. It doesn't have to be that you have kidney disease to do this.
Exactly. It's for whatever kind of health condition you have. And then just like there's dietitians that specialize in renal, there are dietitians that specialize in a ton of different things, you guys. So whatever it is your primary focus is, if it's not kidney disease, that's fine. Look for a dietitian that focuses on that, and then use those ICD-10 codes to help with that qualification of getting coverage.
All right. So what's next? We're writing down these steps. We've learned about these codes. We're not worried that our doctor tells us, hey, you're fat, because we see that as a good thing to get us to a dietitian. We don't want to be overweight. We want to be a healthy weight for our heart and everything. But hey, if you are overweight and your doctor can use that, we're going to say, hey doc, let's do it.
Oh yeah. I know that oftentimes the overweight codes qualify for the most, sometimes even unlimited visits with the dietitian. So it depends on your plan, but don't shy away from that if that's your situation. Underweight may also qualify for that as well, because it's still a weight-related issue that a dietitian can help resolve. So the next thing that you want to do is check to see what the annual limit is. How many visits do you have per year? And this is really important because, kind of like that FSA, a use it or lose it situation, you will have a certain amount to use within the year, and it might not be the calendar year. They may have a different type of, like a fiscal year or some other year they go off of. So you just want to verify, okay, so if it's 10 visits per year, what are those dates? Is it the 1st of 1st to the 12/31st, or is it something else? Get that clarified, written down. Again, this is all recorded. You're going to have that reference number. So the more they tell you on record, the more you are going to have as that reinforcement of this is what I was told. So you want to make sure that you know when the start of your benefits is and the end of your benefits, and if there's any kind of like expiration, you need to use them at a certain time, anything like that. With Medicare, people get basically 3 hours with the dietitian, which in my opinion is measly, but
yeah,
that's just my
exactly.
opinion. My first session with people is an hour and a half, so that's already half the time. But
yep. And for those who have not seen or been with a dietitian, the first visit, at least with my experiences, and I've had, I think, 5 different dietitians, not because they're bad, just because they specialize in different things, and I'm a sponge for knowledge. The first visit is always, tell me about yourself. What do you like to eat? When do you eat?
Mm-hmm.
What do you snack on? What do you not like to eat? What do you think of this? What do you think of that? Would you eat this? There's conversations where they're really learning about me, and also what challenges do I have? What health issues do I want to focus on first or are more important to me? And it helps them learn how to work with me so that it's, first of all, it's effective, and I'll stick with it. They're not going to tell me, James, go eat salmon for every meal when I personally don't like fish. They're going to learn what I do like and work with me. And they may even start with, okay, well, we're going to make this food smaller and smaller and smaller. And this one, we're going to start small and work it up to get you used to it, or show you that there's ways to make it taste different than what you expect, make it taste good.
Yeah.
So that first visit to me is really a get to know you. And then usually the second visit, which is shortly after that, a week or so later, they've printed up a plan. Hey, here's some things. Here's what I want you, your calories. Here's the foods I like to eat. Here's some meal plans. The dietitians are excellent at giving out samples, because I think everyone packs their offices up with samples. That's where I learned about Renadil. That's where I learned about Pro Renal Plus D, a multivitamin. I've learned about all these different little shakes for diabetics, also for those with kidney disease. So much great stuff, and I got to try these samples and figure out, hey, I don't like that shake. Oh, that shake's not bad. I'll buy some of those as an emergency backup, or if I'm traveling and I'm in the car and I don't want to stop. So knowing those number of visits you can get is really, really important. And 3 hours is not very much.
No, I mean, the good news there is that it doesn't have to be like the way I run my practice, where it's an hour and a half in the first one. It could be 45 minutes and then 45 minutes and then 45 minutes and then 45 minutes, if that math is right. Yeah. Yep. So it can be split up differently. But that depends on the dietitian and the way that they run their practice, or the health office that you're going to. But it's good to know what you have available so that you can kind of budget it out and get a feel, and then talk with the dietitian about what the best way to use that allotted time is. Yep. So the other thing that you definitely want to check when we talk about kind of budgeting is asking if you've met your deductible. So the deductible is that amount that you pay up front in the beginning of the year to cover health costs. And the deductible can be different across the board for different plans. So you can find out from that representative how much it is, how much you have left, if there's any kind of expected cost. Because if you haven't met your deductible, you may have to pay out of pocket. But the good news is it still goes towards your deductible. So you're that much closer to getting past the deductible, and then insurance kicks in to cover a larger part of your healthcare appointments and services. So make sure you find out what that is, and get those numbers written down. What it is total, how much you have paid already, what you have remaining, all those details. Get that written down.
And when does it reset? My deductible resets at the end of the fiscal year, so December 31st. Yes. So if I had a doctor's appointment on December 30th, I'd probably push it if it impacted my deductible to January sometimes. If it might be something like, I'm going to have to pay for it, let me just move it a few days or a week and get it towards next year's deductible. So it's kind of a game there. And this is a great place to use your health savings account or your FSA if you have one of those to help with that deductible. And my company, the health savings account, I think they give like $2,500 a year on it.
Nice.
So
wow.
Boom, that takes care of probably like almost half of my yearly deductible on my family plan right there.
Yeah, that's really good. So it's again, it's this whole thing of kind of planning for this and taking advantage of what your health insurance provides, what the other pieces of the insurance can do for you, and really making sure that you're not letting them slide away or just ignoring them. And that's one of the reasons I wanted to talk about this and have this for you guys, is because so many people don't realize that they could possibly see a dietitian. They just don't realize it. And they're thinking that they have to go out of pocket. And it's not necessarily the case. If you go through your insurance and find out, that's awesome.
All right. What's next? We're finding out about our copay. Or we're finding out our deductible. Yes. Next is copay, which is kind of
the copay.
Different than deductible, even though as a patient, it feels the same because it's money out of my pocket.
Yes. So specifically, the copay is going to be a smaller chunk, $20, $10, sometimes $50. It's going to be what you pay towards that session or that appointment. So as a dietitian, I am listed as a specialist. So on the back of your card, you might see like primary, specialist, I think it's lab, and I haven't had a traditional insurance card for a few years now. So I'm trying to think of what is all back there, but they'll have a few of the price points for you to kind of identify in most cases on the back of the card. But it's helpful to clarify if you don't see it, or if maybe you have an older card, you haven't got a new card with new information, just double check. Again, verify what the copay is. And for a specialist, the specialist copay is what would be paid for seeing a dietitian.
Yep.
Okay, so the next thing is finding out if you have out-of-network benefits. So this talks about your healthcare plan and the providers that are in network. As in, these are providers, these are healthcare practitioners that have signed a contract with the insurance company to provide services to their members, which are you. So if you are looking at working with somebody like myself, for example, I do not take any insurances in my practice, so I would be out of network. So you want to find out, let's say if we decided to work together and you wanted to see if the money that we worked on together could go towards your insurance, ask if you have out of network benefits. And if they say yes, then you might have the opportunity of your insurance still covering those sessions. If they say no, it's totally up to you, but you might want to revisit looking at the in-network providers, which very often your primary doctor, whichever referring doctor you talk to about seeing a specialist, they'll have access to those specialist providers. Or you could even ask that representative, hey, is Jen Hernandez in my network? And find out, and they can look me up and they can say, okay, Jen Hernandez, dietitian. I see her, I don't see her, whatever the case is. In this case, you wouldn't find me. But if you know somebody that you want to work with and you just want to find out if they're in network or not, you can ask them on that call as well.
Yeah, and my wife just learned all about in-network, out-of-network. For my daughter, she needs some orthodontal work. And I was saying, stay in network. We get higher coverage. It didn't click until she saw the bills or the estimates on the work. And if we are out of network, it's less coverage, a much lower rate than if they are in network. And if you want to use someone who's out of network, this is another place where that HSA or that FSA comes in handy, because you can use that like a credit card to pay for a dietitian. And a dietitian, relatively speaking, isn't expensive. It's much cheaper than at least for me, much cheaper than my doctor visits. My monthly dietitian is less than my prescriptions. My prescriptions are awful. I got to work on getting my weight down and my blood pressure so I can have less pills. But anyway, that's another great place for that FSA or HSA, if it's available, could be helpful for you guys in covering someone who is out of network and may not be covered at all or is covered at a lower rate.
Absolutely. So I think the last thing that we have to cover is, especially right now, I mean, this is so important with this time, and most often it is, but you want to ask, does my insurance cover telehealth visits? These are all the video chats that we're doing all the time right now. For this past year, we've been doing this. Many insurance companies have, with COVID, they have allowed telehealth visits. There might be an end date. So you may want to ask, is there going to be an expiration on that ability to use telehealth? Because I do know right now they're still kind of figuring out, they set an expiration and then they extend it or they modify it. So, but find out if it's covered, if there's an expiration on that service being allowed, or if you can use it all the time. Because I know there are healthcare plans. When I was in Hawaii, especially with people being on different islands, you're not going to hop on a plane just for a doctor's or for, I mean, some people do that for a visit, but you don't always do that. And some people can't do that. So a telehealth visit would be something that is medically appropriate because they can't get to a certain place. So find out if your insurance covers those telehealth visits and if it's ongoing or if it's going to end at a certain date.
Yeah, and that's something I have taken so much advantage of since, for a little over almost a year now, since COVID started. My dietitian is all virtual. My primary care physician is virtual. Now, he required me to get like one of these little oxygen meters that pops on my finger, and he wanted me to get a good thermometer, certain things like that. So I take my stats just before our virtual visit, so he has everything he needs. He told me I had my last virtual visit. My next one has to be in person, so he can draw blood.
Well, that's exciting.
Get fresh labs. Yeah, I'm excited for them, but I really don't care anymore because I feel great. And as long as I keep continuing to feel great and I can get my weight under control. My weight, that's the thing that bothers me. I got to get it down before I visit him. So I've been very, very good at watching portion sizes and getting on that treadmill every day because I know the clock is ticking to an in-person visit. Now, so those are great tips right there, how to make sure or to find out, is this covered? Is a dietitian covered by insurance? Which will be, for most of you, I think you're going to be surprised. At least they should be covered a few visits for certain reasons. And that code thing that you talked about, Jen, is like the most amazing secret. And it's not cheating. You're just saying, hey, you need to lose some weight. We can use that to get you some visits. You have this health challenge. We can use that to get you some more visits. And hey, if it means it's costing you less money, boom, that's awesome. You're paying for that insurance somewhere. Even if it's Medicare, you're paying through it through taxes you paid. Use your insurance. Take advantage of it because it's there for you. Now, speaking of Medicare, are nutritionists or nutritional services covered by Medicare?
Yeah, so as I mentioned with Medicare, they do cover 3 hours working with a dietitian. And you may be able to get additional hours if your doctor writes in and basically says, yes, this person needs more time with the dietitian. So sometimes it works and sometimes it doesn't, but it is a possibility. If you are on dialysis, then and you have Medicare, your insurance is covering all of your visits with your dietitian in the dialysis clinic. And that's something that I encourage a lot of people that reach out to me when they're on dialysis. And the first thing I say is, do you have a dialysis dietitian? Because you get to see them an unlimited amount of time as best as they can schedule you in without paying anything. It's all entirely covered. So again, this is all about using and taking advantage of the benefits you already have. So if you have somebody there to give you information and advice, a dialysis dietitian is a wealth of knowledge and highly specific into the dialysis world of what works with nutrition on dialysis. So you will absolutely be seen by a dietitian in the United States at least once a month. You at least get a check-in with a dietitian once a month. It might be more if you ask. As when I was in dialysis, I loved it when I had patients asking to see me because I knew they were interested in talking with me and talking about nutrition and talking about what they could do to feel good. So it's always wonderful to be asked to see. So if you want to see your dietitian, request it, okay? We're busy. We see a lot of people, over 100 people every month, but we will make time for you if we know that you are interested in making changes and feeling better. So please take advantage of that and connect with your dietitian because they are a huge resource.
Yep. Doctors and dietitians love it when you are proactive in your health care and you're listening, you're asking questions. They love to share information. And we hear that over and over again from the other doctors that are on here. We have Dr. Rowe, Dr. Butt. They always say, I love it when a patient asks questions. Even the bizarre question, if you accidentally listen to Dr. Google or Dr. Facebook, which are not good sources, take those things you might think that you read, that you think, are those factual? Ask your doctor, ask your renal dietitian. They love helping out with that. Now we're getting close to the top of the hour, and someone just asked a great question. Jane and Bill. They asked, they happen to live in Eastern Canada. Hey, upper neighbors up there. They asked about websites to find renal dietitians. How do I find a dietitian that takes my health care or my insurance that I have? Once I find out, hey, here's what it covers, here's what it works or what it does.
Our neighbors up north, there is a Canadian directory essentially of dietitians that are up there. Since I don't practice in Canada, I don't know too much of the details, but I do know I connect with I just talked with a dietitian in Canada. Her name's Emily. She's up in Canada, and I don't remember what territory, because the different territories have kind of like states in the US. We have different license laws per state. Canada's the same way. It's kind of broken up in that sense. So I do know of Emily, and I'll see if I can't pull up her website, but she's a great resource. I have a listing on my website of places to find dietitians, and you can just go to my website and search renal dietitian near me, and you'll get that page to pop up. And I have a ton of different places. So for the US specifically, we have the website eatright.org. Eat Right is a lot about health and wellness and nutrition, and it's basically about from dietitians that write blogs and talk about a lot of things nutrition and health related. And there is a find an expert button, like a search button basically, that you can click that, type in your zip code, and you'll get a list of dietitians in your area that may be able to help you. And from there, you can click their websites. You can see what kind of services they provide. Sometimes they provide links to their website or to whatever they're offering. So Eat Right is a fantastic one. Another one for this area, for us, all of us, the kidney warriors out here, the National Kidney Foundation does have a dietitian directory, and I send people there all the time. It is a wonderful directory. They split it up into 5 regions. And if you go just look under the states of each of the regions and find your state, click on that region, and you go down to your state and you'll find a listing of dietitians that are in your state or licensed for your state to be able to provide nutrition services. So that is a really great way if you're looking for dietitians that want to help people with kidney disease, because they have reached out to the Kidney Foundation and said, hey, I want to be on your directory because I help take care of people with kidney disease. So that's a fantastic one for kidney specific issues. For Eat Right, you can search for renal, for kidney, or you can search diabetes, high blood pressure, weight management, cancer, pediatrics, breastfeeding, like tons and tons of stuff. So Eat Right is a bigger one for the United States. And then I do have a list on my website of the international dietitian directories. So as I've been in social media these past years, people would ask me about a dietitian in Singapore or a dietitian in Thailand or a dietitian in Sweden or all these different places. And so I started compiling the information that I collected there of resources. So you can, again, go to my website, plantpoweredkidneys.com, and then in the search, type in renal dietitian near me, and that will come up and you can go find your state. And if you don't see it there, just contact me and send me a message and let me know what you're looking for, and I'd be happy to add it to the list. But that is another way. The other way, obviously, all night we've been talking about insurance. So ask your health insurance representative. Can you tell me some dietitians in my area that are in my health insurance network? And they should be able to rattle off some names for you of people that are in your network that you could work with. So that's a great way. Some insurance companies do have directories online, but I know from personal experience when I used to take insurance that I know that it was very tough to get on those online directories, even though I was in network. They didn't really know how to classify us as dietitians, so they didn't know where to put us, and there was no category for us. So that was a whole other thing. But so if you can't find them online, don't assume that there's none. Again, call the representative and ask about a dietitian in network. And then the last thing, ask a dietitian. Ask somebody. If you guys are connecting with me on social media, send me a message, and ask me, hey, I need help finding a dietitian here or here or here, wherever the case is. Because like I said, us dietitians, we like to network and connect. And I do know a lot of dietitians, renal dietitians, dietitians in other focuses, other specialties. And I would love to be your matchmaker and help you find a dietitian.
Awesome. And look at that. Boom, right at the top of the hour. Wow, we are getting so good at planning our time.
It only took like 30 weeks.
and those of you watching, I know an hour is a long time. And Jen and I have talked about making them shorter, trying to make them 30 minutes, but there's just always so much information, plus your guys' questions. And those of you that saw me kind of giggling a little bit while Jen was talking there, I was participating in the comments. And some people had asked Jen, where'd you live? And I said, oh, Tennessee. And they're like, no, I think Kentucky. I'm pretty sure I heard her say Kentucky. There's a lot of Kentuckys. I said, oh, it's in Knoxville or Fort Knox. And they said, yeah, that's Kentucky. I thought it was just pretty funny. Yeah, I had no clue, but you're closer to me in Cincinnati, Ohio than I realized.
And don't worry, chances are we're probably going to be moving, in the near future, because that's just the way it is. But that's why I have a virtual practice, so that I don't have to quit my clients when I leave.
Yep. All right, everybody. Well, that brings us to the top of the hour. Oh yeah, someone says keep it an hour. That's my mom. Keep it an hour. Yeah, there's always so much great information. Let's see. Are there any things I wanted to say at the end of the show? Oh, I will be announcing later this week a giveaway for Renadil. Going to be doing a promotion. Kibo Biotech, the people who create Renadil, which is a probiotic designed for kidney patients. Something Jen used. I thought you were reaching for a bottle of it. Got your bottle of water.
I have my Renadil bottle. I'm still unpacking, you guys. Don't judge me. This is actually a pretty clean room, but I don't know where it's at.
Yeah, I'm going to announce a giveaway because next week I'm celebrating the anniversary of my 29th birthday. That's how I always like to look at it.
Aw.
I stopped counting after 29, and they're just anniversaries after that. And Kibo Biotech said, hey, you know what we'll do? We're going to give away 3 months supply of Renadil and some of the Kibo Fortis fiber pills to help me celebrate that next week. And nobody guessed what my age is. I'm not going to tell you guys. Matter of fact, I always think I'm younger than I am. And I thought I was 2 years younger than what I am now. And I was so disappointed. I was like, wait a minute, that's not right. It's like I marked lines on a piece of paper for each year all the way up to now. And then I counted the lines. I was like, darn it, Siri was right.
I totally go around it and I don't remember how old I am. So it's really easy because I literally just don't even pay attention to it anymore. I have no idea how old I am.
Yeah, I've forgotten many, many times. All right, everybody, I will be back. Oh, wait, here's a huge announcement. I will be back in 2 days on Thursday with somebody new. A friend, I got to point the right way. A friend of Jen's is coming here. She's going to be on twice a month. What? It's a surprise. You guys better tune in this Thursday. We want to give her a big audience.
Yeah, you guys are going to love her. She is amazing. Oh my gosh. I want to give her a big hug, but I can't, but I want to. She's just absolutely amazing.
Yes, I'm looking up what her title is because I didn't want to butcher it. She is a licensed clinical social worker. And we are going to be talking about finding hope when it feels hopeless this Thursday. Oh, it's going to be a good topic. And her and I had a great conversation over the holiday break. I guess it's not really a break. My kids had a break. I didn't have a break. But her and I had a great conversation. And you guys are just going to love her. It's more positive stuff to help us improve our quality of lives while we happen to have kidney disease. All right, everybody. Thank you, Jen, for being here again. Great information. And thank you, everyone out there, for being here. And I'll see you in 2 days. All right, everybody. Bye.